Hello, my name is Jason Arnold, and this is video blog number 5 for Health Informatics course 645. Today we're going to discuss common breaches of electronic digitalized personal or protected health information, as well as probable solutions to address, as well as just kind of highlighting laws that may be broken in this breach process. So very interesting stuff. Definitely working at a state hospital. See this a lot. I know kind of exhausted that information, but it definitely is near and dear to me because this information is usually so vital, or always so vital when it comes to this protected information. But first and foremost, I always like to kind of go in reverse order. I don't know why I do that. But as far as the laws that are broken, because we like to deal with those, formalities first. The laws that are broken usually deal with these breaches or like release or disclosures of information. It's usually, HIPAA statutes and like state confidentiality statutes that are violated when these breaches happen. And they're definitely subject to like criminal and civil penalties because of the civil liability or even vicarious liability if it's talking about ostensible agency, but that's another topic. But as far as the laws and consequences, things of that nature, it's usually state and federal laws that are broken with these types of breaches for wrongful disclosure of protected health information. And if I can go down the consequences of this. Initially, it's usually a $50,000 fine and 1 year in jail. It could be, or if it's done under false pretense, it could be a $100,000 fine and up to 5 years in prison. And if it's done to sell or make a profit or some type of instance like that, it can go up to $250,000 fine and up to 10 years in prison. So the penalties are severe when it comes to wrongful disclosure and breaches of that nature. As far as now I'll go to the beginning. As far as common breaches that we do see, though, especially when you're understanding, these HIPAA violations and these, confidentiality, statute violations, things of that nature. The most common one you're going to see is theft. And again, a lot of times it's for profit or things of that nature. But theft, just because of how this information is stored, is via laptop or desktops or if it's smartphones or other type of devices, the information is so small that it can be it can be stolen and taken or lost so easily that's usually one of the biggest breaches that we see as far as on a I guess governmental or federal level is concerned. Also, employees disclosure, that's like gossiping and sharing information. I definitely see that a lot, again, when people are sharing information, even at work, and then if someone's on the phone and they can kind of relay information, things of that nature, so that's definitely a breach. Medical records mishandling, just like leaving information exposed or unsecure to where people can easily access it, as well as social breaches. A lot of times you see it to where a person is talking to maybe a healthcare provider and they're discussing information for a friend of theirs that's a patient. A lot of times that's going to be a breach as well. That is very common that we see. And sometimes, again, it's not anything that is intentional, but sometimes I guess we don't think about it, especially in rural settings, like I am here in Millersville. We casually discuss things, and it definitely is a breach. Also, illegal accessing files, and I see this a lot as well, especially that legal access to patient files or like illegal authorization, things of that nature. If you're at home and you're accessing a patient's records just because you want to get some work done, that's a breach. And if you have cyber criminals that can hack into your system, that information gets exposed, guess what? You're liable for that. And that's when we start going into those criminal civil penalties, as well as like texting info, things of that nature. Those are just egregious breaches, as well as it's not necessarily a breach, but a cause is just sometimes lack of training. Sometimes people are just not aware of common breaches that they have and things that they can do, and that definitely could be a big no, if I can say that. Now, as far as things that you can do now, I know as a state hospital we're under HIPAA statutes and things of that nature, and we kind of go by the privacy and security rule. And the privacy rule, of course, is just going to make sure that information is obtained and sustained appropriately. Sorry, I'm dropping information. But I want to concentrate on the security rule because that's what like a lot of hospitals kind of utilize, and that's kind of like the operational aspect of that privacy rule, and it kind of includes like the High Tech Act of like 2009, and that's for like businesses and things of that nature, how they operate. But as far as the security rule, it's going to kind of again give you the operational components of how the privacy rule is constituted with different covered entities, like they call healthcare organizations, and how they operate. So, and this is a lot of this information is coming from Health and Human Services site. So I'm just going to give you a few of these possible things that they can do and safeguards that they can take so that protected information, protected health information is safeguarded. So first, they want to make sure that risk analysis and management is definitely one of the first things that they understand. So it requires that covered entities perform, risk analysis as part of their like security management process, just to make sure that those analyses are not limited to, you know, risk in the hospital, but risk that formulate outside the hospital and the potential risks of having those electronic protected health information, as well as administrative safeguards, things like security management process, making sure that security measures are in place to reduce risk. The security personnel, they have to designate security officials to make sure that they're appropriately understanding this information. Have information access management. That's going to make sure that the minimum amount of people that are using this information stays intact, as well as, like I said on my last example, like workforce training and management. You got to make sure that your workforce understands all the policies and procedure when it comes to protect the health information, and that they're utilizing that information accordingly. As well as and that was administrative safeguards and the access of risk analysis management. Also, you want to make sure that you have physical safeguards as well. Those physical safeguards go for like facility access and control, and that's kind of like just again limiting the physical access that you have to facilities while ensuring that authorization is covered, as well as like workstation and device security. Make sure you have policies and procedures in place to that are going to safeguard like the removal or transfer of protected information if you are going from paper to electronic, and then if you utilize that electronic information, you want to make sure that if it's reused electronically, you want to make sure that the appropriate safeguards and protections are in place. As far as technical safeguards, like I said, access control, that's going to be one, and make sure that again, authorized persons, it may sound like a repetitions, but these are different safeguards. You want to make sure that access controls are in place, audit controls are in place. I'm just going to evaluate the activity of these information systems to see if anybody is doing any illegal accessing. Integrity controls, so that you're going to make sure that information is not being improperly altered or destroyed. And again, transmission security, you want to make sure that over the entire electronic network that no, again, unauthorized users are utilizing this information. So these are kind of like organizational safeguards that are going to use that security rule, and that's going to be some types of solutions that are going to help you to prevent these calamities of happening, and prevent the economic risk that many healthcare organizations face because of these breaches, whether intentional or not. That's my blog. Hope I didn't overtalk. Wow, not doing good. So thank you for your feedback. Hopefully it's coming soon. I will talk to y'all at a later date. Thank you.